Good morning, everybody. It's great to see such a big turnout. So my name is Jennifer Brower. I'm a dispensing optician and low vision practitioner, and I'm going to talk to you today about dementia and low vision. So what is low vision? Well, it's low vision is a lower than normal standard of vision, which in most cases can't be corrected by spectacles, contact lenses, medicine or surgery. You can be born with it, develop it in childhood, or maybe later on in life. And just running through common causes of low vision are cataract, macular degeneration, diabetes, glaucoma, possibly stroke. Some of you may recognise some of these names. But as said, in many cases the cataract may be removed and vision restored. And in recent years, medicines have been developed which aim to help prevent further vision loss from macular degeneration. Some people can have more than one condition causing low vision, cataract combined with macular degeneration, for example, or diabetes and glaucoma. And this is important. People with low vision may be intolerant to bright light, so they might be experiencing glare in bright sunlight or indoors in the kitchen with those glossy white kitchen units, give a lot of reflected glare. Now, for those of you who can see my diagrams, the picture on the left is supposed to represent a typical street scene seen by somebody with normal vision. But the one on the right is supposed to simulate how somebody with a cataract might see it. Now, cataract is an opacity in the crystalline lens, which is near the front of the eye, and it reduces transparency and contrast. So the normal eye would see a clear image, and the cataract eye would see a milky or misty image. And people with cataract are often very sensitive to bright light. Now here, the picture on the left again is supposed to be a normally sighted person, but on the right, it simulates the vision of somebody who has macular degeneration. Now, the macula is at the central part of the back of the eye, and it's responsible for seeing fine detail, affects your central vision. So if you have damage to the macula, you might get a grey or distorted patch in the centre of your vision. This time, we can see our normal vision on the left, and on the right, how somebody with glaucoma may see. Untreated glaucoma causes damage to the optic nerve, and although the central vision will be unaffected, certainly in the early stages, the side or peripheral vision will become constricted and you get a blinkered or tunnel effect. So hopefully you can see that they're not seeing the whole picture. And just briefly, other causes of low vision include retinal detachment, where part of the retina, which is the inner lining of the eye, becomes detached. Symptoms are a sudden and significant loss of vision, and often you may perceive a deep grey shadow in the vision, and this should be dealt with immediately at the eye clinic, where the surgeon will aim to reattach the detached part of the retina. High myopia or severe short sight is another cause of low vision, and people who are very short-sighted may develop cataract a little bit earlier. Corneal dystrophy, that's an opacity in the front part of the eye, and again you get reduced transparency and reduced contrast over the whole of the visual field this time. Retinitis pigmentosa, much easier to just say RP. This affects the side vision, a bit like glaucoma does, and depending on how bad you may have the condition, you may need help with mobility, such as a stick or cane, or somebody to guide you, a sighted guide. And albinism, worth mentioning, often associated with very pale complexions, hair and eyes are very pale, but it may only affect the eyes, so you wouldn't actually have an immediate outward appearance. People with albinism don't have much pigment at the back of the eye, and they're very sensitive to light. And because of this lack of pigment, you get reflected light. So I hope those of you who can see this will be able to pick out the patients who have albinism. Those two ladies, particularly on the right, you can see because the camera is shining right at it, you get this reflected straight away. They're a mother and daughter, and they said they dyed their eyelashes and their hair, but I'm afraid the camera gave it away. Brilliant picture, that. Anyway, a bit of a checklist for low vision. how you may know you may be getting it. If you have cataract or macular problems, you may have difficulty seeing TV, reading street signs, bus numbers, other distant objects. It's not working, yeah. You may have trouble recognizing people's faces across the street. And if you have glaucoma or RP, remember we said that constricts your vision, you may not notice objects around you, so you may bump into the armchair or the kitchen table. Some people with low vision will have difficulty reading the newspaper, reading letters, looking at photographs, knitting, playing cards, many of the close vision hobbies as well. And I know we're all talking about light, it's so important. Some low vision conditions will cause a very uncomfortable glare in bright sunlight. Now, to be practical, regular eye examination is recommended for everyone. Somebody's already said that. More frequently as you get older. And it's very, very important to tell the optometrist, as Michael was saying, about any concerns you have with your vision. When you make the appointment, or when somebody makes it for you, tell them that you have dementia, so that the optometrist can tailor the examination to your particular needs. And if you need spectacles, a dispensing optician, like me, will allow extra time so that you're not rushed, you don't feel stressed, and that you're comfortable with your choices. If you do have low vision, you may be eligible for registration as sight impaired, and whether you choose to be or not, you can be referred for specialist low vision assessment and the supply of low vision aids. And many hospitals have low vision clinics, and some opticians do it in practice, as I do. So we've talked about low vision aids, LVAs. As the name suggests, a low vision aid, or LVA, is something which helps a person who has low vision to cope better. And I have a short list here, and I do have some photographs as well. So light, can't mention light enough, very, very useful and natural low vision aid. How much easier it is to read the newspaper if you're sat by the window in the morning, or read a recipe in a well-lit kitchen. The average 60-year-old person is said to need 3 times more light than the average 20-year-old, and an older person with low vision, of course, will need even more. The important thing with light is to have it as close to the object as possible. So if you place a lamp much closer to the newspaper or magazine or whatever you're looking at than you would do normally, that will make things much brighter. If you can't see the TV well enough, there are special magnifiers which can help. And you can improve your long-distance vision with a little telescope or binoculars. Some magnifiers actually clip onto your spectacles for reading. Some rest on the page. And if you have a hobby or you need to have your hands free, some can be worn around the neck. There's also a whole range of large print items such as newspapers, books, phones, watches, playing cards, and tinted spectacles can be used to increase contrast and reduce this glare. So we'll show you a few photographs. This is Wendy, my receptionist. Now she's reading a magazine under a small task lamp. You can see how it is positioned very close to the page. That maximizes the illumination. And the flexible arm allows it to be tucked out of the way when you're not using it. This comes with a strip light. It remains cool, so you don't get the burnt ear syndrome, and it gives you a clear white light. This is a TV magnifier, called the TV Max TV. You wear it like a pair of spectacles and it increases the size of the image. And there's little wheels on the side that you can adjust for your actual viewing distance. It's lightweight, comfortable to wear. And there's also a clip-on version which you can put over your spectacles over your own prescription. Here's Wendy again. This time she's looking through a telescope to read the number of a bus. May take a bit of practice to keep the image still. But if you support your arm as she does with the other hand, it does help steady it. If your vision is similar in both eyes, it doesn't have to be good, but if it's more or less similar type of vision, then you may find binoculars are useful for long-distance tasks, such as the theatre, cinema, watching sport. Now, this is another of my receptionists, Lynn. And she's using this little magnifier just clipped onto her spectacles for reading. You may notice that she's holding the magazine fairly close. If you add any magnification, it's going to shorten the working distance. So that's very, very important. This is one of the new generation of video magnifiers, which is a little mini camera system that can be held or rested on the page as it is there, and that increases print size. It's got variable magnification. And this is white print on black, which is often preferred by some people, but you can change it to black on white, blue on yellow, or full colour. And the magnification is easily increased just at the touch of a button. It's very handy indoors or for things like shopping. Now this is a hands-free option. This is actually worn around the neck, and it can be used for sewing, knitting, painting, playing cards, or any other task I said before that you need to keep your hands free. This one isn't very powerful. It more or less doubles the size of the image, which may not be enough for some people. But it's combined with a bar magnifier. If you can see, there's a red line, and that's part of a bar magnifier, and that increases the magnification further. And the red line helps keep your place on the pattern. Big number telephones, very useful. Apart from the large print on the keys, you can program in frequently used numbers. And here I've got a picture of typical over spectacles, over specs. These have got different colours absorb light in different ways, and they're suited to different causes of low vision. Now the larger three, the top two and the one on the left, they're typically called over specs because you can wear them with or without your spectacles, but the little one is more like a sunglass. The advantage of the over specs is you get very good light protection at the top and from the sides as well, but all of them will give you a complete UV block. And looking after your low vision aids, if you have dementia, of course, it's very important to look after your LVAs so that they're always available to you. So we always recommend labelling each one so you and other people know it belongs to you. So it could be Sue's TV LVA, something she uses for the television, or her reading LVA, for reading the paper, John's shopping LVA, Jane's knitting LVA. Very important to label them. If you can get some photographs of yourself wearing your LVAs, you can put them in your room around the home to remind you. And if you have a care plan, then put photographs in there to remind you also, and your carer. Very important, if you do wear spectacles, you may wear spectacles for different tasks. You may use some for television, other ones for reading. So include which ones go with which LVAs in your care plan. And as Gemma was saying, very important to keep things clean. Keep them clean for the best results. Get them checked regularly for damage. Some LVAs have batteries in and lights, so that needs to be checked as well. Do take your LVAs with you when you go out shopping, when you visit friends, if you go into hospital, so that you'll always be able to see as well as possible. And finally, have your vision examined regularly to check the progress of any eye condition and to make sure your spectacles are up to date, of course. Also, get reviews regularly on your low vision aids. Make sure they're still right for you. And when you make appointments for an eye exam or low vision assessment, note them with the other appointment dates in your care plan. That's it. Thank you very much.